The 2021 Reproductive Health Survey is ongoing, and the Statistical Institute of Jamaica, STATIN, says it's being done with the COVID-19 safety protocols in mind. The Reproductive Health Survey, RHS, is a household survey that looks at the fertility, contraception, and reproductive health of women and men aged 15 to 49 years. Head of the Special Projects Unit Surveys Division at Statin, Filoni Mantuk, shared some details about the project in a recent JIS think tank.
Data collection for the 2021 Reproductive Health Survey began in August and will end in December. Statin's Filoni Mantuk says interviews are done privately due to the sensitive nature of the information being requested.
Working at Statin, they can be rest assured that anything that they provide to the interviewer is held in the strictest of confidence. Interviewers have to sign a Secrets Act as well as a form of oath, and this adheres that they maintain the confidentiality. Anything that is disclosed to them, they have to keep it private. The tablets that we collect the data on, it's password protected. The application system is password protected as well, so it is very hard for somebody to break into the system. Any data that we collect is published in an aggregated manner. We remove all names from the data set. Anything to identify a person is removed, and any respondent will be given a unique ID number that doesn't indicate where they are or where they're from.
She also pointed out that based on how the selection is done, a respondent's neighbor would not be a part of the sample. A total of 11,080 dwellings across all parishes are slated to be visited during the data collection period.
So we'll ask questions about partnership history, questions related to fertility. So for the female, we'll ask about how many pregnancies they've had. In terms of the male, we'd ask them how many live births they have had. Questions on contraception, tobacco and alcohol use, HIV, a lot of things about their perception, their knowledge and attitudes towards sexual and reproductive health.
In light of the risks associated with COVID-19, Ms. Mantuk says all interviewers and supervisors have been issued with personal protective equipment.
They've been instructed about observing the protocols. Interviews are done in private, so it's not done in a group, so it's one-on-one, and it has to be done in private because it's very sensitive information. So you and the respondent alone, and they will maintain the protocols.
The survey is being conducted by Statin on behalf of the National Family Planning Board. Melvin Pennant, PBCJ News.